Polio poses a serious threat to children aged 5 and below, and the first line of defense is immunization, which gradually boosts the immune system of recipients and gives them a layer of protection against the potentially crippling disease. The vaccine will be administered orally to children aged 5 years and below, alongside a vitamin A supplement. The first round of the program will run from 12th to 15th November, whilst the second will begin on 12th December and end on the 15th of the same month. Vaccinators will visit houses, schools, markets, and other public places. The World Health Organization's emergency team lead argued that the vaccine is safe, free, and that there is documentary evidence to prove that it is the most cost-effective means of protecting children from the preventable disease.
The poliovirus poses a very significant global concern. It is a disease with devastating consequences and places a high risk on those who remain unvaccinated, often leading to severe complications, including paralysis. We have a responsibility, a moral obligation to protect our children from this vaccine-preventable disease. The WHO and global partners have 4 strategies to control polio virus. One of them is acute flaccid paralysis surveillance. The other one is high coverage of routine immunization. The third is National Immunization Days, which we're about to do in the Gambia.
Sidat Fofana, program manager, expanded program on immunization, posited that the success of the campaign hinges on the involvement and participation of all stakeholders and at all levels.
We strengthen the immunity level of our children so that they may not have this wild polio virus as it is spreading in the sub-region. So I would want to call on all of you here that this message we are spreading here today should resonate beyond this conference hall, should go as low as to the last child in this country, every corner of this country.
UNICEF's nutrition specialist, Yankoba Sao, talked about the importance of the polio vaccine and the need to ensure that no eligible child is left behind.
UNICEF is proud to be a key partner of the Ministry of Health in this effort and delighted for organizing this stakeholder engagement for the upcoming polio campaign. Today marks another milestone in our resolve to protect every child from all forms of deprivations and disability. Poliomyelitis is a debilitating condition that can be prevented by vaccination early in a child's life. Because it is preventable, we cannot afford not to act in a timely manner as we prepare to launch the National Polio Vaccination Campaign scheduled from the 12th to the 15th of November 2024. The success of this campaign relies on the active engagement of stakeholders at every level, from local communities to government agencies and international allies. Together, we can ensure that every child is reached and protected against polio, moving us closer to a polio-free future.
The Gambia has managed largely to keep polio at bay, but the porous nature of our borders and the level of travel within the sub-region make it all the more necessary to carry out a periodic polio immunization campaigns to reinforce our defenses. Oumie Njie, GRTS.